Hello everyone, thanks for joining. I'm really glad you can make it to this video today because today we are going to take Mr. Skella's vitals. Would that be okay if they helped us? He said yeah. Let's go get our equipment. Oh, the cringe. Today from Mr. Skella, we will be getting 4 vital signs. We'll be getting heart rate, blood oxygen levels, blood pressure, and respirations. Let's go over the equipment that we're going to need to take these vital signs. Manually measuring heart rate will require a watch or a timer. For blood oxygen levels, we use an oximeter. For blood pressure, we use a stethoscope and a sphygmomanometer. To take a patient's heart rate accurately, there's a few things you need to keep in mind. One, is the patient currently performing some kind of activity? Because intense or strenuous activity can change a person's heart rate. Also, are they on some kind of medication to elevate or to decrease their heart rate? Those are good things to know. Now, there's a few places where you can take a patient's heart rate. Let's go over them. A pulse can be measured in the temporal artery, the carotid artery, the brachial artery, radial, and the dorsal pedal. There are plenty of places where you can take a person's pulse, but out of convenience and more commonly, we'll use the radial. Now, what I'll do is I'll place the pads of 2 fingers over the lateral aspect of the radius, and whenever I feel the pulse, I have my timer or watch, and I will turn it on to 1 minute. Let it go. And I'm counting each time I feel that pulse or a thump against my fingers until I reach 1 minute. Okay, Mr. Skella, that is 0 beats per minute. On to blood pressure. When you measure a patient's blood pressure, you are measuring the amount of pressure that the blood is exerting on those vessel walls. There will be 2 numbers involved. There will be a diastolic number and a systolic number. The diastolic number will be the lowest pressure that is exerted on the walls, and the systolic pressure will be the highest pressure exerted on the walls. In order to begin to take the pressure, you will need a blood pressure cuff or a sphygmometer, as we mentioned earlier, and a stethoscope. I am going to place it on the brachial area of Mr. Skella's body here, on his arm or his upper arm, because I'm going to use the brachial artery to hear that pressure against the vessel walls. Now let's measure his blood pressure. I've put the cuff on his brachial area because I'm going to be using his brachial artery to feel or to hear that pressure against the vessel walls. First, I'll palpate to feel the artery. Once I found it, I'll place my stethoscope right on it. Looking at my gauge, I squeeze appropriately, and I'll slowly decrease that pressure. First number I hear is the systolic. And then after, I hear the diastolic. All right, Mr. Skella, your blood pressure is exactly 0/0, as expected. Now on to blood oxygen saturation. Nowadays, measuring a patient's blood oxygen saturation might be the easiest vital that you can take because of this guy right here. This is called an oximeter. An oximeter, the way that it works, is that for the patient, this is placed on their finger and it has certain sensors within it. When you press it on and you relax, it will give you the percentage of oxygen that is in your blood. And many of them also give heart rate. So before I even start or I put it on Mr. Skella here, some things that you need to make sure before you place this on your patient. One, are their hands cold? Is the finger that you're going to use, does it have an appropriate pad? Is it a really skinny finger? Is it really, really cold? Because sometimes if it doesn't have a good surface area or a good pad on the finger, then it will give an inaccurate reading. So, feeling his hand, grabbing whichever finger, placing it on, and just waiting patiently. Great. And Mr. Skella reads 0%. Nice. On to respirations. Last but not least, we have respirations. Measuring your patient's respirations lets you know how many inhales and exhales they perform throughout 1 minute, which would indicate the average of their inhales and exhales at a rest, okay? Now, a tricky thing is that sometimes when you tell your patient that you are measuring their respirations, because breathing is something that we can control, sometimes that will make them nervous or that will make them breathe in a way that is not normal to them, so that gives us an inaccurate reading. So some will say, or they will advise, that instead of saying, I'm going to take your respirations, you will say, oh, I am taking your pulse. Because the pulse you can't control and the patient is not aware that you are measuring their respirations while you are taking their pulse. So the way that I will do it is I would say, hi, Mr. Skella, I will be taking your pulse today. But instead of taking the pulse, I will be measuring his respirations. So here I have a minute, and okay, Mr. Skella. To measure one respiration, you are looking for the rise and fall of the chest. That would make one respiration. So Mr. Skella here, he had a total of 0 respirations. Thank you so much for joining me, guys, and helping me take Mr. Skella's vitals. He got hit by a moped when his friends dared him to cross the road. You know, he's a little beat up, but he'll be fine in a few days. Anyways, I hope you learned something, and I will catch you guys all the next time. Bye.